And I just wanted to touch base with you and see if there was anything that you need or anything that you don't like or anything to feel free to let me or let me know and I can make sure that this is correct for you.
Oh, wonderful. I appreciate it. This is wonderful. I'm so excited to be here and appreciate the opportunity to connect and partner. Thank you.
Definitely look forward to continuing to do something with you. So definitely keep us in mind.
Yes, definitely. We were just having some conversations about some possibilities. So I'm excited and looking forward to it.
Yeah. Okay, well, you have a great program. Please feel free, like I said, if you can anything that you need or you don't have, definitely we have a little thank you bag for you to take with you as well.
Thank you. That's so
So
sweet.
you have a great program. We really enjoyed working with you and look forward to continuing to do so.
Yes, I'm excited to do that. Thank you so much. It's been a pleasure to get to connect around this. It'll be wonderful.
All right.
Talk to you soon, Maggie.
Okay, take care.
All right.
You too. Bye-bye.
All right. All right. Let me tell. Chinese was on jump on. You got your computer set up, right? So y'all could test before Dr. Hopper, you know.
They don't want me to do it. You gotta talk to them. They're not using my computer, they're using theirs. I'm only gonna be on the Zoom call with everybody else.
But they need to test.
Okay, well,
Well, I don't know. Why? Hi. Shanice said she was gonna try to get in on her. Shanice is gonna try to get on, so you can run the test with her.
Okay.
So we don't have a whole. Do we have a whole Zoom? Premium Zoom, because he said the room only lasts for 40 minutes.
They've been calling this thing. The hip was the last forever. That's why I always use Microsoft Teams.
Back up.
Ain't no limit.
Right.
Okay.
That's what Juan just said. That's why he didn't wanna open it. When you said that the Zoom only lasts for 40 minutes,
Yeah,
right?
Zoom was only lasting for 40 minutes.
Why?
I don't know.
It's our account.
Right.
Oh, well, is it supposed to
I'm
go?
on our account. Are you on our account?
Yes.
With the events at dnwayne.org
Mhm.
and that funny.
But it'll go.
Okay.
Yeah, it'll go.
Yeah, because just a few minutes ago, I just had it open and then it shut down. So that's why I was thinking it was only 40 minutes.
Okay, you Wi-Fi.
I don't know. I thought on your own Zoom, it lasts as long as it.
No.
Right.
So it should last as long as we want.
Yes, ma'am. Yeah.
I just want to see if there's anything I need to be doing.
No, they sent me down too. I'm just asking. So, if you want to join the Zoom as well, I don't know if you want to be in the Zoom as well, but we have someone moderating the Zoom already.
Oh, is it helpful for me to hop on or?
Sure.
You're gonna- Do you need?
Probably not. Because everything, like they're gonna be able to see the screen. So when your presentation goes, there's gonna be a camera pointed up here. So they'll be able to see you, see the room, see the screen,
Yeah.
the screen, everything.
That's awesome.
Yeah. Yeah. I think they got it under control. I feel awkward too, just sitting around,
I
right?
feel like I should be doing something.
Right. I don't, there is a restroom right this way. If you go out of this room and make, make a left and go down the hall. There's a restroom, women's restroom right there. Our
Good idea.
office is right across the hall, and we have printing capabilities and all that stuff over there if you need. So you know where the elevator is, and there's water fountains back that way. I don't know if you, so whenever you need, you just let me know.
I'm good.
Okay.
Yeah, but just in case people have.
Are you all okay if we put out slips for like our email list?
Absolutely,
Make sure Before
absolutely,
we do it. that people can
absolutely.
choose.
So one of the things that I did yesterday was I said that as folks come in, we're gonna give them white cards. So if they have questions, they can write their questions down. And myself or Dr. Lydia will ask the questions for them. So hopefully that'll even be a little bit more intimate for folks. Because I think when they talk about gynecologic things, it's kind of
Yeah. we might be hesitant to-
like, so if they don't have to actually put their name on
Yeah.
it, it can be completely anonymous. They can get their questions asked.
Yeah. That's great. That's a great idea.
Well, it was twofold, so it kind of started out of need because we don't really have a walking mic. But then I was like, oh, that works good for anonymity, so people will get their question answered.
Yeah, absolutely. And if they're medical related questions, I can get them to,
Yeah.
you know, if you have them written down, that's even better, because then I can get them to one of our medical advisory boards.
Right. And then Dr. Harper said that she's prepared to field any questions as well. If she can't, I'm sorry, if she can't answer now, she will get her team on it.
Awesome. That's
Yeah,
awesome.
Dr. Harper is
That's great. I looked at her
bio.
profile. She seems great.
Yeah, she is. She's phenomenal. Yeah, and so she's gonna kind of talk about the. I think she's really gonna talk about the impetus for her coming up with the tool, and she's gonna show like how the tool was designed and all that in her presentation.
I'm looking forward to seeing that, because that's a
Yeah.
huge.
At first, I was a little like, is that really what we wanted to do? But then the more I thought about it, I was like, well,
Yeah.
that kind of brings it home with kind of what I was talking about the sexuality piece and the disability piece and providing that access.
Absolutely.
So her presentation kind of encapsulates
That's great.
that.
That's
So
wonderful.
I'm sorry that we couldn't do a more of a deep dive into ovarian cancer, but
I'm sorry that we didn't get the sign off.
but we can always start planning now.
You know, if we reach out a little bit farther, one of the providers is usually
Right.
available that we've worked with, because I know we talked to some Carlotta who was willing, but there's
Yes, well,
Yeah.
right,
their surgery days and
right.
all of that.
So
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
Good morning, Dr. Harper. How are you?
I am great. How are you?
I'm doing well. I'm Dr. Lydia Butler with Disability Network.
Wonderful.
We're just trying to get the last bit of things together. I'm going to let you speak with Jamie Jr. since you've been communicating with her.
Sure.
All right.
Hey, Jamie. I actually can't hear you, but maybe you'll get closer.
How are you?
I am good. How are you? Oh, now you froze.
Here,
There
okay,
we
now,
go.
you're back. We just got a pop up there. Something's wrong with our internet. Our Wi-Fi. Hold on, here's Debbie.
Okay.
Thank you so much. Thank you so much for,
Joining us.
Oh, yes.
Are you on your phone?
Might be the mics. Yeah. There you go.
Okay.
So the mic is live. That's what it is.
Unless you got the Zoom on.
Mm-mm. All right.
So you want me to?
Yeah. I'm gonna go over there and make sure.
Okay, she's gone again. No,
It might be her.
no, I don't think so. No, it's not Dr. Harper. She's looking great.
Yeah, I'm here.
I know, she can hear me just fine. It's these other.
Yeah.
All right, just give us a few minutes.
Sure.
To go on. If you're not doing anything in sales first, go on Henry Ford. Get off of this little network Wi-Fi. Go on Henry Ford Wi-Fi. Cause it's interfering over there. Why you gotta always ask why? Please.
Jamie,
Oh.
Jamie.
What's your reply,
Yeah, that's what it's gonna be. Are you in sales first or champs or anything like that?
Just a moment. Let me turn this audio off.
You can go on this daughter.
Okay. Remember? All right. Good morning, everyone. Greetings and welcome to Disability Network, Wayne County, Detroit. Here at Disability Network, Wayne County, Detroit, our mission is to empower, advocate, and educate individuals with disabilities while promoting independent living and inclusive pathways. We are honored today to be partnering with the Michigan Ovarian Cancer Alliance, MOCA for short, to have this critical conversation about gynecologic cancer and women's health for those of us with disabilities. Our goal with today's conversation is to, number one, build awareness and understanding of gynecologic cancer. Number two, discuss the importance of screening and gynecological health care, particularly for women with disabilities. And to have a discussion about the importance of accessible healthcare and the role that advocacy can play in improving health outcomes. Today, we are once again pleased and honored to be joined by Megan Neubauer. Megan Neubauer is the executive director of MOCA. Megan has over 8 years of experience working in nonprofit organizations. She completed her undergraduate work at Capital University, earning degrees in social work and psychology. She then completed her master's degree from the School of Social Service Administration at the University of Chicago. Megan is originally from Northeast Ohio, lived in Chicago for several years before moving to Michigan with her husband, and now lives in Ypsilanti, Michigan. She is excited to join MOCA and contribute to the work of the organization throughout the state. Our next guest is Dr. Diane M. Harper. Dr. Harper is an internationally recognized family physician and clinical research expert in HPV-associated diseases and their prevention, early detection and treatment for the prevention of cancer. She has been a consultant for the World Health Organization and the Pan American Health Organization to advise on global guidelines to set up screening and prevent operations and prevention operations, in low and middle income countries to prevent cervical cancer. She is the first family medical physician researcher to be inducted as a member of the Association of American Physicians. Dr. Harper, as a physician researcher, has a strong interest in public health, epidemiology, and health behaviors, all fields in which she has published over her 30-year career. She has over 300 publications and tens of thousands of citations, and is ranked third among co-cited authors in the HPV cancer vaccine and cervical cancer prevention literature globally. Without any further ado, I would like to turn it over to Dr. Diane Harper.
Thank you, Jamie. Can you hear me? Is this good? Are we okay? You're on mute? Okay,
Yeah.
okay, great. I'm gonna start by sharing my screen. Oops, the host has to allow me to share my screen. While the host is doing that, I want to mention how important the population of women with physical disabilities is. That population is extraordinarily important, and it was a very sad fact for me to find this week that when we look in our cancer registries, we do not have a data element that indicates whether or not the woman has any kind of disability. So we don't have the ability to even tell you how many women with physical disabilities or any other disabilities develop cancer. And I think that's a shame. And I think that's an advocacy issue that needs to be shouted out to NCI, that this has to be corrected, that this is a special population, and we need to be able to get the data to know whether we'll be able to go forward with it. Yay. All right. I can share. So are you able to see this now? I think so. All right. So what I will start with is saying that my particular area of interest is in a viral infection called human papillomavirus, known as HPV. Merck has been sponsoring ads on TV for the last 15 years to help give you knowledge about getting vaccinated. It's very important to be vaccinated because that does prevent at least 2 and up to 7 of the types that cause cervical cancer. Vaccination cannot prevent all types that cause cervical cancer, but half of the types is better than none. I say that because HPV is an infection that's spread by skin-to-skin contact. And that usually implies some kind of sexual intimacy or some kind of sexual contact. And I would like to share that women with disabilities are women, and these women are often sexually active and often at risk for HPV. So as background, what we're going to talk about is that cervical cancer is caused by human papillomavirus. We have literature that documents that 94% of women with physical disabilities have had some kind of sexual activity that may be consensual, that may be wanted, or it may be unwanted. And those are both real events that happen that make you at risk for developing cervical cancer. We also know that approximately 15% of women who develop cervical cancer have their HPV infections from no known source. We know that from the data that women with physical disabilities are 48% less likely to receive cervical cancer screening, to receive a pap smear, than their able-bodied colleagues. So we know there's a deficit. We know women are not getting screened. And at the same time, there is money put into advertising campaigns to say, why can't these women get screened? So there's an increase, 25% more likely to be targeted with a recommendation to be screened. And that creates a really large disconnect. Why do women not come in to get screened when there's an increased push to get them screened? Well, maybe it has to do with the fact that they don't particularly like the screen that's being offered to them. We know that women with physical disabilities who sit in wheelchairs are also at increased risk. We know that these HPV infections are correlated with other vaginal infections. We know that the pH of the vagina, how acid the vagina is an indicator of other infections. We know that the vaginal temperatures change along with the pH throughout a menstrual cycle. And we know that when you're sitting all day long, that the temperature and the humidity of the skin surfaces change the microenvironment and the local pH. All of those, the temperature, the humidity of the skin surfaces, the change in vaginal pH, all of those increase HPV infection, persistence, and progression to cancer for women with a physical disability. So we decided to talk to groups of women, both as individuals as well as in groups, to see why, what's going on, what's happening, what is their lived experience. And so I'm going to share with you just some of the responses that we've had. The very first one talks about the inability to use the stirrups in the table. I can't bend my knees. That's real. A distrust that the exam is not well done and it's rushed. I hold my legs, but the doctor rushes through the exam. I'm worried that the doctor's exam is not thorough and the test is meaningless despite my efforts. There's a cold speculum. Cold speculum means it's a metal speculum. It triggered muscle spasms and I could not spread eagle. Creates questions about self-image. I've never tried to look at my genitals and I'm worried, am I normal? Because I already look different from the outside. There are nurse attitudes. The nurses could hold my legs, and that was a little awkward too, as I wear leg braces. The nurses were nice about it, but they had to be asked to help because I'm not able to spread my legs. Physician attitudes were important. No doctor wanted to do a pelvic exam on me, and it really frustrated me. My doctor actually said, "You have a cute little cervix." Physician behaviors. My second time was for yeast, and my doctor said, wash yourself. And it just, I guess, the way she worded it, it totally, like I'm already in a vulnerable state because, I mean, my legs are up here, like it's just really awkward. Worry about how she was perceived by the medical staff. How would the doctor react to me? She seemed awkward and kind of almost seemed a little, I do not know how to explain it, but bothered that she had to do it. I was different than other women, like, because I could not position myself normally. She didn't talk to me afterwards. And then office accessibility. The accessibility issue in the office includes changing into a gown, getting out of the chair, getting up on the table, worrying about falling off the table, getting off the table, who's going to be in the room when you're undressing. And these are just a few of the comments that we heard from women who said they really wanted to take care of themselves, but felt like they weren't part of the team and they weren't part of the effort to help make sure that they would not develop cervical cancer. So we've started on a community-based project. We are working with you in the community. We want you to know that we're here and that we want to work with you. We have a project that has started, and the purpose of this project is to develop self-sampling kits that you can use either at home or in the office or wherever you're comfortable using them to determine what would make it easier for you to screen for cervical cancer when you don't have to get up on a table and take your clothes off and put your legs up in stirrups and spread your legs apart. We know from science, and we know that from other testings that we've done, that the accuracy of detecting HPV, the same virus that causes the cancer, we can detect it both in a vaginal swab as well as in a urine specimen. Now, the urine specimen is very special because it's not clean catch. We're not interested in you doing all of that work to clean things off. We want all of those cells that are sitting there. So that becomes the golden test for us. And it's mostly easier for women to be able to just pee into a container than it is for a vaginal swab. But again, some women may prefer a vaginal swab. So we are going to do a study where we're going to recruit 40 women. We have 2 different urine collection kits, and we have 3 different vaginal sampling kits. And we're going to ask women, how do they use these kits? Are they easy? Are they hard? Does it make sense to them? Are they comfortable using them? Will they use them? And we think that each woman will have a different preference based on her culture and her needs. We're going to separate this study into 2 different aims. We think that younger women, 25 to 45 years old, may have a different experience than women who are closer to menopause. And we're interested in understanding how those differences differ. How different is it for women? We also want to look at what kind of HPV genotypes do women with disabilities get? Is it the same as the general population? Or does that vaginal change in that vaginal pH and that microbiome cause a difference in HPV types for women with disabilities that we as healthcare professionals need to be aware of to be able to partner with you to make your health better? So in particular, we are looking at trying to find women who would be interested in working with us, specifically Black and Indigenous people of color, including our MENA participants. We're looking for women 25 to 65 years old who have some kind of physical disability to participate with us in testing out sampling devices and then participating in interviews to determine what their responses were. How did they feel? Was it better or worse than the in-office exam? How comfortable? What doubts do they have? These are what we want to hear from you, because only you can tell us how this is working for you. We're looking for Native American and American Indian women to participate. We know these groups of women likewise have much lower rates of cervical cancer screening. And in general, we're looking for any woman who has some kind of physical disability who might want to participate with us. Now, what I'm going to share with you in the next couple of slides is what some very wonderful undergraduates at the University of Michigan who are studying engineering have helped us to do. Their task in working with me was to design a urine collection kit that could be used by women with disabilities to be able to collect this urine. And so they've called themselves Team Packed Prevention and Accessible Cervical Cancer Testing. It uses natural urine collection, not any kind of clean catch. And these are young kids in their late teens and early 20s. I'm so proud of them. I'm so proud of their foresight and their ingenuity in delivering this kind of new screening device that hopefully will be usable by people who can't and don't want to get up on the table and have a speculum put inside. So this is a group of committed engineering students who want to support women who are underscreened for cervical cancer, specifically women with physical disabilities. And what do? They're a team of undergraduate students at the University of Michigan working to develop a non-invasive urine collection device for primary HPV testing for cervical cancer screening. This device can be used while sitting down. Who are they looking for? They're looking for you. They're looking for women with physical disabilities who will help them through these design stages and say, yeah, that wasn't so good, or that one was better. I like that. Why we need your help. We're hoping to have conversations to learn more about how we can develop our design to be more accessible and comfortable. We aim to send our eventual end product to be used by our target end users for further feedback. So this is what they started with. Initially, they started with something like this bracket to put on the toilet and this kind of collection device. And I will tell you that it's quickly changed to something that looks much easier to use. So this slips around your toilet. This is the vial that you'll see is important for their engineering design, but not as important for you to know. And this is what the vial looks like from the outside. This is the way that the urine comes through and flows. And when there is enough urine in the collection device, it stops. And that's the important part of it. So overall, this is the funnel. That funnel gets put up underneath the bracket. It's very lightweight, and these are biodegradable products that can then be recycled. And this is the vial that comes down and allows you to be able to, I'll go back to that, that allows you to be able to sit, do your peeing. It automatically collects the urine in a little side tube here, and the rest of your urine goes into the toilet. And that gives us the ability to screen. And then you or your caretaker can take that little vial that's collected at the bottom of that funnel and send that in for HPV testing. It's really as simple as that. So this is our sign up. This is, I'm leaving my slides with you so that you can see them and you can respond to us. You can talk to us. You don't have to take pictures right now, but this is the Harper Lab Research Study Interest Form. We are not ready to start the study right now, but if you are interested in hearing more about it or in signing up for it, we give you both a URL, a website address, as well as a QR code that will take you to our website. And this will allow us to get back in touch with you when it's time for the study to start, to see if you would like to participate or if you would like to help us recruit more women who could participate. So I'm very excited with what we have done so far. I'm even more excited about what we can do in the future in making this screening for women with disabilities a much more effective process. So I would be glad to take questions, and I'd be glad to answer questions about female health in general, whatever is your wish.
Thank you so much, Dr. Harper, for the echo. For your presentation. I'm excited for us to work together and spreading the news about your survey and your research project. I'm excited that you will be able to be great. So we do have questions. Is it a good idea for family members to receive genetic testing if they have a family history of cancer? Is that something that you recommend?
So cervical cancer is not an inherited disease. It is not something that your mother or grandmother can give to you. It is caused by this virus. And if your mother or grandmother or aunt also had cervical cancer, it's likely they probably were also infected with the virus HPV. So when we do the collection kit, we're looking for HPV, and we actually type, so we know there are 14 different cousins that live in that HPV family. And we type to see exactly which one it is, so that we know going forward in the future, should you get a different infection, we would be able to understand that and know what we can do to help you get rid of this HPV. The second part of this, of our work, which is not specific to women with disabilities, but for all women, is we're currently looking for a treatment for women who get HPV and their HPV progresses into what we call a precancer lesion. We have vaginal suppositories that we're currently testing to see if that will treat and make it go away. That way you wouldn't need to have surgery.
Okay. Another question that I have is related to something that we talked about. Actually, during your slide, and the question is related to women who sit, like women like myself who sit in the wheelchair, and mentioned the temperature changes in the personal area because of that. Is that a risk for developing some type of infection that could lead to cancer?
I'm hearing a lot of echo on my end. I'm wondering if someone might be able to repeat the question.
Is it still there?
Yes, the echo is still there.
Can you No. Can you hear me now?
I can hear you, but I hear echoes.
Okay. I don't know. Oh no.
Can someone put the question in the chat?
What about now? Is the echo gone?
It's not gone, but I can hear you better.
Okay. What I'm asking is, due to the temperature changes in the vaginal area for women who are in wheelchairs that sit all day, does that put us at greater risk for developing an infection that could lead to something like HPV or other cancers?
I don't have an answer. You guys may know better than I. Some kind of cushion that allows air to flow under your bottom so that it doesn't get, the temperature doesn't get hotter.
Okay. It's back. So you said air cushion, but what? So air cushion can help. Is there anything else that can be done, like some kind of absorption? Is it good to wear something to absorb the moisture? Or will that
It's always better to wear cotton clothes. We know that women who run around in leggings and in the Lycra pants that they use for running, that they're also at increased risk because their vagina gets hotter and they stay sweaty all day long. So that has been an unwanted outcome of wearing a lot of exercise clothing. So I would encourage you to not use polyester and not use nylon, or use it minimally so that it doesn't make you hotter.
Okay. Can you think anything else that we should know about helping to prevent something like HPV or cervical cancer? What type of test can be done? I can recall when I had my son. I had my son by a cesarean section, and they did a dye. Can you explain that?
Can someone type it into the chat? I'm having a really hard time with the echoes.
Okay. Don't worry about it, Dr. Harper. I can send you a list of questions. I'm so very sorry for the feedback. I definitely appreciate you being with us today. And I'm sure our audience did. And we're actually sharing it on our Disability Network Facebook. So a lot more individuals than are here in the room with us will be able to hear and glean from all of your research and your knowledge. So again, I appreciate you being here.
It's my pleasure, and my hope is that we will get you the same medical services and the same cancer prevention that we have for all women. There's no reason for you not to participate in that, but we have to do it in a way that is mindful of what you can and can't do. And I think that self-sampling and self-collection going into the future is very much within your own empowerment and your own control. And that I'm very excited about for you.
Yeah. I'm very excited about that. So being able to do that in the comfort of my own home without the extra embarrassment on top of the fear, on top of everything else will definitely be a relief, I would say that. So again, I would like to thank you for all the work that you do in this area, and thank you for having the mind to develop such a tool. And I look forward to working with you in the future to make sure that more women are aware of what you're doing.
I appreciate it very much. I do, and I look forward to hearing more from you, Jamie.
Okay. Thank you. And I know that you have to leave. So again, your presentation is recorded, it was streamed, so we have, if you would like to make sure that you receive a copy. I'll be more than happy to make sure that you receive the recording of today. I don't want to hold you up if you have to go. Our next presenter is Megan Neubauer. Megan is the executive director of MOCA, which is the Michigan Ovarian Cancer Alliance. So, it would be great for you guys to meet at some point, and I'm gonna make sure that information is exchanged. So now I'm gonna go and turn it over to Megan. Thank you. Over here. And probably will, and you'll probably be seeing better.
Except to read the line. I'll go ahead and stand next to it.
I can stand over.
Yeah, right now I'm shooting the sign. There's a cutaway. Oh, we got to turn the mic back on too. Because switch it off.
There we go. Wonderful.
We're turning this off.
And we'll make presentations up there.
I believe it's gonna go. The presentation. She has a presentation that needs to be played in the room. How's that gonna work? Okay.
I can go back up here.
Yeah.
Yeah. Right up
Transition.
Um,
You're on one.
Unplug and replug.
we're still getting the bugs out, Megan, forgive us.
Oh, no problem. Technology, right?
Yeah,
It's a wonderful thing, but you know
It-
what can come up.
and that's true. You never know what's gonna happen. Probably should have had you join the Zoom and then present from there.
I can do that.
Never camera, one. The little camera. He's on that camera. I know. Jamie, I need you to talk to my teeth out a little bit.
Okay. Thank you, everybody. Just be patient. We're working out a few technical difficulties. We'll be right with you.
Just talk about your next steps.
Oh. Okay. Well, we're excited again to work in cooperation with MOCA, which is the Michigan Ovarian Cancer Alliance. They do wonderful work in the community. They have lots of resources, support groups. They work to build awareness about ovarian cancer in the communities that they serve, and they participate in research. I know that they have a speakers bureau that goes out and talks with physicians. You do that during the clinical periods, right?
Yeah, when they're training. Yeah.
Yeah, so they do it for the students. And do you do like in the rounds in the hospital?
We don't, but we do that in partnership with the Ovarian Cancer Research Alliance. It's a program of their organization, and we have folks throughout Michigan go and participate. Our survivors participate and train students so that they know what to look for ovarian cancer. But we do have a community counterpart to that program called Speak, and that is a MIOCA program that provides the same kind of educational and informational presentations from survivors through community groups. So anybody's welcome to request one.
That is
folks coming together.
That is definitely awesome. And excited to see one of those in person. And I'm excited about the possibility of even working with some of the doctors to talk about women with disabilities, maybe women with physical disabilities that might have to have treatment and how they could better be of service.
Of course, yeah, that would be a wonderful collaboration for sure. Yeah, we're excited for it and excited for the partnerships, and I'm so glad to be here with you today, and thank you for having me and the opportunity to collaborate around this presentation. I'll go ahead and I think we're up and running, so hopefully everybody can see me now. So yeah, thank you for the opportunity to be with you. Just wanted to give a little bit of information about MIOCA, the Michigan Ovarian Cancer Alliance, and the work that we do. So we are a statewide organization serving individuals across Michigan with ovarian cancer, their families, communities, and providers. And so we've been in existence since 2011 and provide a various support services and some other pieces that I'll go into in a little bit. But ultimately, our goal as an organization is to ensure that for anybody with ovarian cancer, if you or your loved one or anybody in your life has been affected, that we are here as a resource, as a support for anybody going through that journey. We are also available to communities. So our interest is to make sure that everybody has information and resources, knowing the risk factors and the symptoms of ovarian cancer so that you can advocate for yourself within your health setting and ensure that you feel empowered to be able to have access to treatment, know risk factors and anything that you might need to ensure that you have access to the care that you need throughout your lifetime. So just a quick overview of ovarian cancer and some of the statistics. So it's not the most common gynecologic cancer. There are many types of gynecologic cancer, but it does affect 1 in 78 women, or 1 in 78 individuals born with ovaries throughout their lifetime. So it is fairly prevalent still. And the challenge is that only 15% of diagnoses happen at the earliest stages. And this is because, so Dr. Harper was talking a lot about screenings for cervical cancer, Pap tests and things like that. Unfortunately, the Pap test does not detect ovarian cancer, and there isn't an early diagnostic test. So we still heavily rely on knowing your family history. So when we had a question a little bit earlier about genetic testing, that is something that with ovarian cancer can be a tool if you have a family history of different cancers in your family. And I'll go into a little bit more about risk factors there. So, about 19,700 people in the US will be diagnosed each year. In Michigan, I believe the last numbers that were reported were between 600 and 700 individuals each year are diagnosed with ovarian cancer. And these are the symptoms. And this is where some of the challenges come in, because you'll notice it's bloating, difficulty eating or feeling full quickly, pelvic or abdominal pain, and urinary frequency or urgency. And so these are pretty common, right? These can happen to individuals for a lot of different reasons, or might come monthly. But what we try to emphasize is that these are things that might be unusual for you, or are a change and might be persistent. So always, if there's something that's of concern, the thing that we like to talk to people about is always talk to your provider, always bring this up. Make sure that you're not just pushing it aside. You know your body best, and so listen to that. And so there are additional symptoms, but these are the four most common. And then these are some of the risk factors that I was just mentioning as well. So a family history of ovarian, breast, and breast cancer especially are something that if you have a family history, talk to your provider about it, talk to them about the other risk factors, or who in your family has been impacted, so that they can talk to you about things like genetic testing or other options. And that's because a portion of ovarian cancer cases are connected with mutations or genetic mutations and things that can be passed down and hereditary. So the ones that people often know are like BRCA1 and BRCA2, or BRCA1 and 2, which are also related to breast cancer. So being postmenopausal, increased age, these are all things. So you can be impacted by ovarian cancer at any age, but increasing age is also a risk factor. And then you can see some of the things that decrease risk, such as pregnancy, such as oral contraceptives. So always good to know and have the information so you can talk to your provider. So as an organization, we provide a variety of different services for individuals with ovarian cancer and their families and communities. So we really have 5 areas that we focus on. We provide education around ovarian cancer, and I sometimes connect that in with our awareness as well. So things like our SPEAK program that we were just talking about, programs like Time Michigan Teal, which we do throughout September, which is our awareness month, that really highlight to the communities information about ovarian cancer, because we don't want anybody to be surprised by ovarian cancer or have never heard about ovarian cancer if somebody in their life is touched by it. We advocate, so we do state and federal advocacy to really focus on increased research, services, and access to care. Focus on ovarian cancer, cancer in general, and gynecologic cancer specifically. And then we fund ovarian cancer research grants. So researchers throughout the state are doing some really exciting work to focus on treatment options and also looking into earlier detection. Because we don't currently have an early detection test, it's something that we're really, really interested in connecting around. And so we support research to really move the field forward, hopefully, and improve treatment outcomes. And then we also do survivor support. And so that's something that if you or someone in your life has been touched by ovarian cancer, we have ovarian cancer survivor groups, so specific to an individual who's been directly impacted. And we have those monthly in a couple of different groups, including for younger survivors as well. And then we also have a friends and family group. So if you have someone in your life who is going through cancer, ovarian cancer treatment, and you'd be interested in connecting with others who are in a similar situation, we do have a group that's available statewide for that. And it's on Zoom. So these are just a little bit more about our programs, our support groups. We do really try to facilitate survivor connection, because sometimes you just need to know that other people have gone through this treatment or this journey. Hear what they found helpful, what has been available to them, the resources that they have. So those are all pieces. And we also provide totes for survivors. So anybody who's been diagnosed or is experiencing a recurrence can request a tote, and that has a variety of comfort items, gifts, information, and resources from us at the Michigan Ovarian Cancer Alliance.
That's awesome.
We also have a variety of events. So if you ever just want to connect with us, whether you have been impacted or you just want to connect with us and be a part of the organization or learn more, we have events throughout the community at different times. So for example, we'll be at a Tigers game at the end of June, I think it's June 24th, where we're trying to get teal, which is the color of ovarian cancer awareness, out there more, and to raise awareness through a table and connecting with other people, but also as a space for survivors to come together and connect with one another and their families.
That's awesome.
Yeah, we're very excited about this. All of the opportunities we have to come together are always a great time to connect with each other.
Cool.
Just an overview of our research grants. We're very, very proud of those and excited for them. And we'll be doing another round here this year soon. They're opening up any day now. And then our programs and outreach that we do throughout the community. So we're available, whether you are interested in learning more, whether you're interested in having programs in your community around ovarian cancer awareness, or whether you have somebody who you know or you have directly been impacted by ovarian cancer. We're here to provide support and services throughout the journey. So this is just an overview of the support groups that we have currently that are available. We have all of this information and opportunities to register for these on our website at neopa.org, and all are currently available virtually, or as we go back to some in person as a hybrid option as well.
Teal Sister Support Group.
The
I
Teal
love
Sisters,
that.
yes.
I love that.
It's a great group. It is.
That is
So yeah, that's just an overview of a little bit about ovarian cancer. And it's one of those things that unfortunately isn't talked enough about. As with all kinds of gynecologic cancer, we really hope that we can start these conversations more. And so that's why we're so glad to be partnering today, to have this opportunity to talk about how we can ensure that everybody has the support that they need, everybody has the resources they need, the information to talk about their risk, to seek care as needed, to advocate for themselves within the medical field if they need it, and also to connect with one another if they're going through ovarian cancer or gynecologic cancer in general. So
that is so cool, Megan. Thank you so much. So we do have a couple questions. Many of them you did answer during the presentation, which was very comprehensive, by the way. But I want to go back to some of the symptoms that you talked about.
yes.
The bloating, the difficulty eating, the difficulty eating, abdominal pain, and the frequent urination. So all of those symptoms are associated with menstrual cycles. And one thing that's prevalent in the African American community is prolonged menstrual cycles or fibroids, which prolong your cycle. So is there a link? Do you know? Have they done any research to see if the condition of fibroids or will have any link to that cancer, or would it mask it?
Yeah, I mean, so I don't know that I can talk about the research comprehensively, but I can always look that up and get that information over. But the challenge is, I think you kind of hit it, that oftentimes these symptoms can be a bunch of other things and can be blamed on other things, right? So it might be, fibroids or prolonged menstrual cycles that often get, explain away some of the symptoms. Or, it can be something that also comes up often is like, it can be related to menopause. And so they're often really vague. And so we do, it's not something that people necessarily rely on, but the idea is if it's unusual for you, it doesn't feel right. And it's something that is, coming up for you or frequent, always talk to your provider, always feel that you can bring this to them and feel that you can advocate and talk about your family history, talk about risk factors, and just talk about ovarian cancer in general with them, because that at least opens up the space, right? So, because so often we see these kinds of things either brushed aside by the individual, by people who are like, well, it might be, or brushed away by, or explained away, I guess, by other folks. It's just so important, and that's why it's such a big piece to advocate for yourself if it doesn't feel right or you're not getting answers.
Yeah, thank you for saying that. So when you say advocate for yourself too, that brings up another thought for me. And how can I connect if I'm feeling uncomfortable with the attention that I'm getting at the doctor? If I'm going and I'm saying this is new for me, and so unfortunately, oftentimes women health conditions are just, oh, it'll go away. Are there folks that I can connect with at your organization, even though I'm not a survivor, to say, hey, these are the symptoms that I'm having. I'm really uncomfortable. Is there some advice? Like if people just wanted to connect to get advice on how to more effectively advocate for themselves.
Yeah, and we'll put out there that the on staff, we are not medical providers, so we can't provide, kind of from a medical side of things. But if you need resources, we're always happy to connect and see if we know of other resources or folks in the community that can connect and support throughout that process. Additionally, we usually, see if somebody has been able to connect with somebody in their hospital system. So oftentimes there are social workers or nurse navigators or folks who can help people walk through the system as well. And there are a variety of other, groups, organizations, and resources that we can always connect people with if you're looking for something that you're not finding at your provider's office. So,
Okay. And if a person is newly diagnosed, and been through treatment and want to become an advocate, or if there's someone in the community that wants to be an advocate, how easy is it for them to connect with you guys?
Yeah, we're a phone call or an email away, so feel free to reach out to us always. I'll put that our email address up there. So our phone number is there. My email address is here. If there are ways that you want to get involved, we are available. So we do, if you want to advocate at a legislative level, we do connect with groups that have opportunities to be a part of advocacy days. So we're always happy to get you connected there. You can become a volunteer to tie your area teal throughout September to bring out those ribbons that we have that have all of the symptoms and information about ovarian cancer and get that out to your area. And pretty much however you can see that we can connect and tap into community partnerships, we are always happy to be in conversation and find new ways to support folks throughout the community.
Okay. So the other question that I have is, do you all support individuals in getting a second opinion as well?
Yeah, that's something that, again, we don't necessarily do it in-house, but there is the Michigan Department of Health and Human Services has a online, or I guess it's a phone system that offers navigation if you have received a diagnosis of ovarian cancer. Oftentimes you can always, if you're comfortable, you can ask your provider. Usually people are very comfortable with getting a second opinion, especially with something like gynecologic cancer, where, you know, there are different treatment options and kind of weighing what's the best process for you. So you can always with them. You can talk with your insurance company as well to talk about who's in network and what the system is. But then we can get you connected with the ovarian cancer navigation line through the state to really help you find what are the gynecologic oncology providers in your area, who's accepting patients, who's available, and everything like that. So that's a great way to navigate getting a second opinion if you've received a diagnosis. And I did just want to mention that we do, you know, if you've been diagnosed, it's highly recommended that you seek care from a gynecologic oncologist as well, because they're going to be the specialist in gynecologic cancer and ovarian cancer specifically. So
That is awesome. So you guys provide a plethora of support for individuals to lead them to resources. In that way, you guys are very, your work is very similar to that of Disability Network, right? Because we provide information and referral resources as well, and help folks develop their advocacy voice, which I hear from you guys do as well by providing the Survivor Speak program that you have, which is very empowering.
yeah, it's a great program, and it's amazing to hear so many different stories and the way that people have navigated the system. And I think that's a huge piece of learning, you know, learning about how you can advocate or how you can navigate. It's hearing all of these stories of individuals who had, you know, had to navigate through to get to their diagnosis and through their treatment. So
Yeah, I think that's a common thing among people who have any sort of disability and or health condition. I think the stories are what help get us over, because if we know that somebody else has been there, done that, and survived, we feel confident that we can do it too. So that's awesome.
it is. Yes, that's a great point.
Yeah. So I think all of the other questions that we had regarding how your organizations provides help and support, you answered through your presentation. And I believe I heard you say that not only do you have support groups for those directly impacted by ovarian cancer, but you have support groups for family members as well.
Yep, family and friends, anybody who has somebody that they love who's been impacted by ovarian cancer. We have a group that we just recently started for people to participate in. Anybody across the state of Michigan is welcome to join us on Zoom.
Cool. So one other question, and it may be redundant, so please forgive me. So family or friends, does that include support for kiddos?
So unfortunately, the work that we do is specific to adults. So our groups are all focused on adults, but there are other groups such as Gilda's Club comes immediately to mind that has groups that are focused on kids.
On kids. So
Yep,
if
so-
their parent, if their mom has ovarian cancer and they need support and connection, then you will refer them out to a Gilda's Club or something like
Sure.
that.
Yeah, community resources, because there are a lot of groups doing amazing work, and you know, we are a smaller organization focused, you know, on Michigan, but there are groups across the country and all over that are doing some amazing work that we always are happy to refer.
Yeah, this work helps you sleep good at night, right? Because you know that you're helping people.
It does, yeah.
Well, again, on behalf of the Family of Disability Network and everyone that has viewed or will view this wonderful presentation, we thank you so very much for being a part of our family and coming to join us today.
Thank you so much. It's been a pleasure to get to collaborate around it, and we're so glad to be here. So thank you.
Thank you. So I guess we can close it out. I want to give you any final words you want to say.
No, just, you know, always feel free to reach out to us if you have questions or if there are things that we didn't answer. And if we don't have the answer, we will look into it for you or find a resource or connection if we can. So please don't hesitate.
Awesome. So, again, for those just joining, my name is Jamie Jr. I am the Advocacy and Community Education Coordinator for Disability Network, Wayne County, Detroit. I'm joined here today by Megan Neubauer, who is the Executive Director of MOGA, or Michigan Ovarian Cancer Alliance. And we want to thank you for tuning in to learn more about what you can do to help us fight gynecologic cancer. Have a great day.
Everyone.